My name is Dr. Michael Derry. I'm a concierge physical therapist here in Jacksonville, Florida, and today I want to go over a comprehensive lower back pain strength and mobility rehab program that I run clients through. This is going to be a great program. We're going to be working on mobility of your spine and hips. We're going to be working on strength. This is totally safe for those who have arthritis or degeneration. You'll be listening to your body as we go and learning some new things, but this would be a great program to start off your day with, to just get you started off to a great start of your day. Get you feeling better, safe for your back and hips. But if you do this for 3-4 weeks, I guarantee you're gonna notice improvements in range of motion, mobility, and strength. Let's go over right now. Let's have some fun. If you guys have any questions, leave them in the comments. Let's not delay any longer. Here we go. All right, let's go over this great program here. So we're gonna be improving your back strength, mobility, range of motion. We're gonna be hitting all of that stuff. So I'm gonna do it on a yoga mat on my floor. You feel free to do some of these in your bed. Floor is ideal. You can bring a pillow along. You'll probably support your head throughout. Listen to your body as we go. Listen to my cues. That'll teach you kind of how to do it, and then the reps and sets along as we go as well. So along the way, if you have any questions or anything, just pause it or leave a comment in the description. But let's get started. We're gonna be starting on our back. Let's improve some mobility and let's have some fun. So this first one here is a pretty common exercise. You're gonna be working into what's called lumbar rotation, and we're just gonna dive side to side. We're gonna be working here. Oh. So when I'm doing lumbar rotation, I'm really listening to my body. So how far I rotate side to side is based off of how my back feels. And so right now it's a little stiff. Oh, I'm just gonna keep rocking. I'm letting gravity pull my legs down. I'm not forcing my legs down. And with every rep, I notice I can go further and further. And so when I rotate to the left, I should feel it on my right side. And I rotate to the right, I should feel it on my left side. And if you're not getting anything from this, just go to the next one. Doesn't matter to me. But for me, I really like this rotation. And we're gonna rock left and right. I think we're about 10 reps here. We're gonna be doing a few more. I'm not gonna skip any steps today. We're gonna go through this together. We're gonna be hitting it. So this is rotation. Good. Oh, this last couple ones here is gonna be really good. Oh, a little pop. I don't know if you guys heard that one. That was awesome. All right, so now we're gonna move right into flexion and extension. So this is just called posterior tilting. So I'm gonna tilt my pelvis. So I'm kind of flattening my back, and then I'm increasing this space here. So I don't know if you could see that, but I'm flattening and I'm increasing. This does a couple things: range of motion and motor control. So let's say one of these is uncomfortable, then don't push it, right? Just work into the discomfort. I tell my clients, just flirt with it. Feel that little bit of range of motion and mobility gaining. Flirt with your discomfort, flirt with it. Now, traditional stiffness and achiness responds really well to this. This is good mobility work here. We're gonna be tilting, tilting, tilting. All right, this feels really, really good. Perfect. So we've done the lumbar rotations, we've done the tilting, the posterior tilting. We're gonna be diving into some cooler stuff here in just a second. All right, so now I'm gonna place my feet. We did flexion and extension and rotation. So now I'm gonna place my feet firmly, nearly under my knees. We're gonna be diving down into this range here. So you're gonna be lifting your butt and then back down. Up and down. This is the classic bridge. What I'm thinking about is driving through my heels, and I'm pinching my glutes as I'm getting to the top. Here and here is a big difference, right? We want to work into that full range of motion if we can, up and down. I think we're at about 4 here. 5, 6, 7. Now you should be feeling a little bit of burn on the top of your legs or in your buttocks. 9, 10. As a physical therapist, I'm awful at counting. Don't trust me to count. I base this off of feeling. Ooh, I'm feeling pretty good. A little bit of fatigue. We've worked some mobility. We're doing a little bit of strength. Good. We're gonna go to a set of 20 here, which I think is feels like an infinity away. Very good. Oh, from there, you should have felt a little burn. So we'll bring those knees to the chest. Feels really, really good. Oh, we're diving in that range. Go ahead and keep pulling on those knees here. I'm gonna adjust the knee here for a second. Oh, okay. Okay, still on my yoga mat. I'm still looking good, feeling good. All right, so we did the knees, chest. We did the bridges, did the knees to the chest. We'll give ourselves a little bit of love. Give that spine some love. 5-second hold here. Breathe out, enjoy that range. With our next one, I'm just gonna have you keep a hold of one knee and let the other one extend. And then let's say you kept the right leg up. Let's pull over to the left side for a good count and a good pulse at the end here. So whatever you feel like you can go, just pulse into that range. You wanna feel it into your glute. You don't wanna feel it in your groin. If you're feeling groin pain, stop, don't pull that far, okay? Pulsing at the end of the ranges here, a good hard pull. Pull, 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 you got 2 more on that side. And whatever side is left, you'll switch. Explore that big range. I had another pop, that's so awesome. I'm not saying I'm addicted to crack, but what I'm saying is when my back pops, it feels good. Oh, my left glute is sore today. Yikes. All right, keep pulling here. 5, 4, 3, 2, 1. All right, so we just got done with a mobility exercise. We're gonna go back into the strengthening. We're gonna kick it up a notch here. We're gonna go right into the single leg bridge. So kick out one leg and lift. Okay, if single leg bridge is too tough and you can't lift your hips off the ground, that's okay. Just do the regular bridges. Be like, Michael, this is awful. I'm doing my regular bridges. And that's fine. Okay, I'm gonna stick with the single leg because I haven't worked out today. So I'm diving through improving the strength and mobility. I think that was about 10. I'll do 10 more. 9, 8, 7, 6, 5, 4. Am I pushing through with my arms? Absolutely not. I don't cheat. Maybe I did cheat a little bit. It's okay. It's totally okay. 9, 10. Whew. Guys, that was a tough one. Why do 10? I don't know. 10 was hard. You could do 15 or 20. That's great. And if you're doing this over a few weeks, I'm sure you can do more. Whew, it's just totally fun. So what do we do in the realm of PT? When things are challenging and they're really fun, we do them again. Absolutely. We're going to be diving through this here. 4, 5, 6. This has been shown to have really good EMG activity of your glutes, which means you're getting a lot of firing, and that's why it's hard. 8, 9, 10. Other one. 1, 2. I'm just a little bit better on my right side. You might notice one side is stronger than another. Totally normal. People have a side-to-side preference in strength. 9, 10. All right. Even if you did the regular bridges, doing a few sets of those is definitely going to be challenging. Knees to chest. Give the body some love. Give your back some love. If you're feeling really, really up for it, you can go right into Happy Baby, which you just grab kind of the big toe and you extend your legs. Oh, I couldn't do this a long time ago. I've herniated a disc in my back. I've got some stuff going on there. And just diving into that big range feels really good. Whew, we've been on our back for a little bit. That's a-okay. So we've done some rotation. We've done some beginning strengthening. Okay, now we're gonna go into the hands and knees. Oh. Okay. We're gonna be going through prayer stretch first, so hands up, butt down. Good, 10-second breath here. That was definitely not 10 seconds. Just one breath. Big breath in. Breathe out. Breath in. Breath out. All right, so that works into flexion of the spine. Now we're gonna move into flexion and extension. So it's just gonna be the cat camel. Okay, tuck, poke, tuck, poke. Totally safe for those who have arthritis, totally safe for those who have stiff backs, or just improving mobility. One thing that I found to be really beneficial in my practice is focusing on improving range of motion and mobility, then working into the strengthening. We got our 5 reps there. Now we're gonna dive right into thread the needle. So right arm straight, reach with the left, and then reach for the stars. Switch sides, left arm straight, reach underneath with the right side, and then reach for the stars. Ooh. Reach. 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 So mobility exercises, you know, the perfect amount of reps to do. It's based on your body. I usually just do it until I feel looser, okay? Once I feel like I've kind of maxed out, then I stop doing it. So for me, that's about 1 rep here. Good. And as always, we go into the prayer stretch just to give ourselves a nice stretch and relaxation. Okay. Now after that prayer stretch, we're going to move into a little bit of strengthening here. So what I'm going to have you do is hands and knees. You're going to curl your toes underneath, and you're going to lift your whole body up. And we're just going to stay strong here. If you have a little history of bunion, you may have pain with this, such as you can go on the tops of your feet if you like. Traditionally, if you wear shoes, it can be a little less uncomfortable. But I'm thinking about engaging my core here. That feels really good. And back down. Go right into the prayer stretch. Or child's pose. Relax that back. Come back up and lift. 3, 4, 5, 6, 7, 8, 9, and relax. Good. We're gonna do one more. Tabletop here. 1, 2, 3, 4, 5, 6, 7, 8, 9, and relax. We're gonna go down. Enjoy that good stretch. Guys, it's not one individual exercise that's gonna make a huge difference. It's doing them all. It's running through, putting in the work, working on range of motion of your back, and improving the strength of your trunk and your hips. And that's what all of this is doing. So that felt really good. It's totally normal to feel some back stiffness and achiness. You just keep diving through that, keep working through the range. We just worked into the tabletop position, and now we're gonna keep moving forward. Okay, so we just worked on improving core strength. We've done some hip strength. We've worked into rotation and flexion of our spine. So we're just gonna keep this train rolling. We wanna make our back resilient, and this is how you do it. You put in the work, okay? We're gonna be working into the strength and resiliency of our spine. Enough talking, let's get to getting here. Okay, so we're gonna be working into more trunk strengthening, and that we're going to be doing the classic bird dog here. So arm and leg, arm and leg. So it's right leg, left arm, and it's right arm, left leg. I don't care how far you lift it, just getting off the ground is fine. Watch this. This is still work. This is also work. Everybody's body is different. Breathing through there. That good bird dog works into that back. When I'm lifting this leg, I'm thinking about squeezing my glute. Squeeze that right glute. Squeeze that left glute. Totally fine if you're a little wavery. If you're rocking side to side. I get it. This stuff is tough, especially if you haven't done it for a while. But if you do this for a few weeks, you're going to notice a big difference. Still work, guys. I don't know how many times I do this in a day. Still gets tough. Still gets tough. Keep going here. Made up numbers, 9. And what do? After we work into some strength, we go into the child's pose. Ooh, I'm going a little deeper into the stretch. It's awesome. Okay. Good. All right. Working into a higher level exercise here. We're going to go right into our planks. Extend, extend, hold. Now, let's go from that plank to a downward dog. Pedal those feet, butt in the air. And then plank position and upward dog. Slow, controlled, and up. Here we go. Now, let's say you don't have the arm strength to pop up like that. That's totally fine. Just do what you can. Upward dog. Keep your hips relaxed. Keep them on the ground. Okay, downward dog. Wait a minute. Am I doing a yoga video? Yoga is very good for your hips and back. This works into extension of your spine. and get you more tolerant of standing tall and laying on your belly. A very normal range for your back. I think we're at rep number 4. We're gonna go to 5 here. Press up. Up we go. 5. Let's do one more just for fun. Press up. And come up. All right, feeling taxed. What do we do? Child's pose. Breathe it out. Now, if your hips are a little pinchy, top of the groin, top of the hip pain, spread your knees out, and then sit down into it. Feels good. Okay, guys, that was a little flavor. That was a little taste of something that I typically use with clients. We went into flexion, extension, rotation of the spine. We did some beginning strengthening. It's a great place to start. It's a great way to start your day. You should feel looser and stronger. And speaking of looser and stronger, let's finish off with one of my favorite stretches, which is a good windmill. So you're gonna go right leg over left, and then just reach to the right. Oh, big pull here. And then left leg over right. Pull your hand down on your knee. Feel that stretch, and then reach to the left. It's a great stretch. A little flavor of what I do with clients should get you feeling better. Stand up, see how you feel. You should notice more range, a little bit more mobility, less stiffness, less achiness. And I promise you, if you do that for 3-4 weeks, every other day, you're gonna notice a big change. This is a great program to work on if you have a stiff, achy back and you just wanna start feeling better. I do this with clients all the time. Let me know what you guys think. But as always, guys, stay healthy, keep moving, and take care of yourself.